Hey there, I'm Beth Connors, a midwife and mom of two, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. Welcome back to episode 73 of Your Birth Bestie podcast, where I empower moms to make confident decisions about their pregnancy, birth, and postpartum journeys. I am your host, Beth Connors, a certified nurse midwife and childbirth educator, and today I am finally back after some time off, and we are diving into another topic that comes up for so many expecting moms, myself included, and that is how to avoid the temptation of induction of labor and instead trust your body to go into labor naturally. And if you've been following my own personal birth stories, my labor was induced by my provider breaking my bag of water for my first two deliveries. But this last pregnancy went to 41 weeks. And I had a feeling that I would go past my due date because my first two babies, I was induced at 39 and 6 and 40 and 2. But that mental game that is the end of pregnancy is absolutely wild. So naturally, there is this huge temptation to induce because there's that aspect of planning that can be great. And also at that point in pregnancy, just discomfort-wise, I felt done. I know so many other moms feel, done. So I have totally been there, and I have helped so many moms through this exact scenario. And this is why I wanted to share my thoughts too about encouraging you to stay pregnant, of course, if you want to, and if you're healthy and your baby is healthy, and you are wanting labor to happen naturally. So in this episode, we are going to explore why so many women feel pressured to induce, how to overcome those pressures, and then some strategies that midwifery care can provide to support you. So let's get started. So before we get right into the solutions, let's talk about some common struggles that might be on your mind right now. And the first one is feeling pressure to induce. So maybe your healthcare provider or even a well-meaning family member or friend is suggesting an induction, just to be safe. Or maybe they've only had inductions before and it seems weird to be somebody who's not agreeable to that maybe. It's easy to feel in these situations backed into a corner and that you're the one that's thinking things that maybe is out of the normal. So here, the thought is that your baby is healthy and doing well right now at this exact moment. So why not just induce to ensure that everything is going to go well because everything's fine right now? But this disregards the entire process of a labor induction and what comes with that. And that is a whole nother discussion that we can talk about. But in addition to that, there's also anxiety about timing of your induction and about timing of your due date in relation to that, number that was given to you when you first found out that you were pregnant and you first had that ultrasound. We spend all of our pregnancy looking forward to that date that's given to us. And everything in pregnancy is based on this certain due date. So that as, the magical date as it passes or approaches, it is normal to wonder or even worry, what if labor doesn't start on its own? It is such a concern that labor won't start naturally, but there really isn't anything to back this up other than us being impatient, right? Labor isn't starting because your body and your baby are not ready at that moment. And with such a high number of inductions, it's, 1 in 3 women are being induced. We're not even giving our bodies a chance to let them go into labor. So we don't even know when it would happen, probably because we don't give our bodies a chance. You will not be pregnant forever. It is just a matter of waiting. And most women don't even know the average time for a mom to go into labor is about 40 weeks and 5 days for your first pregnancy and about 40 weeks and 3 days for, additional pregnancies. And that's average. So if you're giving or taking a few days or even weeks, that is totally reasonable to allow your body to labor naturally. You also might have heard that induction is easier or more predictable or even necessary once you hit your due date. But this is absolutely not true at all. As someone who has supported birth for many years, it can be very challenging to be admitted to the hospital for a day or even more of cervical ripening. Or if you are lucky, maybe it would take a half a day, but this is basically the process to ripen your cervix in order for them to start the induction. And then while you're exhausted from just being in the hospital for a day and you're pregnant and you're excited and nervous and anxious, then in that, not very advantageous situation, labor is then artificially started. So this is when things actually begin. And because your body wasn't ready, it can take some time for this induction process to progress, which then, of course, is more exhausting and causes more intervention to then continue going along, which then can lead to that cascade of interventions. And also just more emotions and feelings about your birth plan maybe not going as you initially had hoped it would. Not that induction is bad at all. That is not what I'm trying to say, but it is definitely a process that can be very challenging. And I want to make sure that we're not sugarcoating induction in this way because it's something that women need to be fully informed about when making this decision. Labor is challenging in general, but to then force our body into it, I feel like it's just a really big decision and one that you need to have all of the information before you can make. Sometimes, of course, it is medically necessary and recommended, or sometimes it's even very much wanted by the parents. And this is absolutely your right once you are fully informed. But I have just seen so many families come into the hospital for inductions, and it feels so important for me to share this information and help you in your experience because so many of these families are coming into the hospital not knowing why they're being induced or how the induction process happens. It's very much just on the spot. And that's a very challenging situation to be a part of. So I'm trying to give you all the information ahead of time if this becomes an option that you are interested in. So those are a few things that you may have heard that can definitely make the idea of induction tempting. But I also want to spend most of the time talking about why it might be worth pausing to then explore your options and ask more questions. The first thing is helping you understand your body's natural timing. Your body and your baby are working together in ways that don't always match that textbook definition of a 40-week pregnancy. Everybody is so unique, and even every pregnancy can be different with each individual person. I have had moms who naturally went into labor well after 41 weeks and had a smooth, beautiful birth. And then I've also had moms who went into labor at 37 or 38 weeks, either their first baby or even their third or fourth baby after they've already had very long pregnancies. So we just don't know what to expect, and waiting doesn't mean that something is wrong. It means that your baby's just not quite ready yet, and finding that peace and that patience will really help you in this journey to meeting your baby. When we misunderstand due dates and the timelines of it all, it can lead to unnecessary stress or interventions. So instead, my advice would be to focus on the fact that every pregnancy is unique. Your body absolutely knows what to do, and we are just here to support it. I also wanted to talk about some of the myths around induction. And the first one is if you are predicted to have a big baby, this means that an induction is absolutely necessary. And in reality, these predictions are often very inaccurate when we are guessing by ultrasound or even, palpating and measuring your belly from the outside. I've worked with many moms that they have been told that they're going to have a big baby and they agree to an induction only to deliver an average-sized baby. I also personally have been on the opposite side of that spectrum of not knowing that I was carrying a large baby when she was on the bigger side. But everything else was normal in my pregnancy, and she came out almost 11 pounds. So if your provider is scheduling an induction for a quote-unquote big baby, this is most often not even a thing. And I would encourage you to question it and learn more about it and ask lots of questions. And I do have a previous episode about big babies and why we don't have to be afraid of that, because our bodies are truly amazing and can really, adapt to whatever baby that we are birthing and growing. So go back and look for that episode if you're interested in a conversation I had with a pelvic floor physical therapist and why we don't have to be afraid of big babies. Another myth is the idea that the placenta ages out after a certain time. While the placenta does change over time, it's not automatically dangerous past 40 weeks. Evidence-based care helps us monitor any risks and helps guide decisions appropriately in your pregnancy, with, of course, you being fully informed and at the center of this care. And this is why individualizing care is so important and looking at the whole situation and you as a whole as you are going through your pregnancy. This is probably one of my favorite parts about being a midwife, is that the model of care doesn't focus on pregnancy and birth to be pathological. It is about critically thinking about mom and baby as a couple, and then customizing care and recommendations as they are appropriate with you and your partner and all of your values and what you're envisioning for your birth to be at the center of your care. And you are the ones making the decisions. So when you are given these reasons about induction, it is okay to ask for evidence or even get a second opinion and find a situation in which you feel comfortable asking questions and confident in the decisions that you're making. This helps you make decisions based on facts and not fear. So let's talk next about support. And surrounding yourself with a team that respects your goals and your values can make so much of a difference. For example, when you partner with a midwife, you gain a care provider who advocates for your preferences and educates you on all of your options with no biases. This wouldn't be any different in the case of an induction, right? It would be something that is addressed as necessary, of course, if something medically happened, but it wouldn't be forced if you were planning a physiologic birth. If the goal is to keep labor and birth as hands-off as possible and as natural as possible, induction, of course, would be avoided and not at all considered for elective reasons or for convenience or for discomforts. You would be supported in your decision and encouraged to follow your birth plan as best as possible. Remembering that you are not alone in this journey, that you have your team of your birth team cheering you on and ensuring that you feel empowered and informed to make these decisions. And if that initial decision changes, week by week, you're seeing your provider more often, that's something that should be respected and supported as well. And that's just a continuous discussion that you're having with your care provider that you trust. And hopefully nobody is, forcing an induction upon you or fear-mongering you to believe one way or the other. Hopefully it is rooted in information, evidence-based, and you are able to feel confident in, going forward with an induction or holding off on an induction if that's what you choose. And I know if you're wanting a natural labor but have been pregnant before and are having flashbacks to those final days and weeks, or maybe you are there right now hoping to not be pregnant much longer, it is completely understandable that you are feeling impatient as your due date approaches. That is something I think all moms get to at some point if they are very close to their due date and just mentally, dealing with those emotions. There are natural ways as well to encourage labor progression that could potentially be worth a try, because at some point, if there is a chance that they could help move things along, many moms will definitely opt for that encouragement of labor to feel some sense of control. But I do want to say to, do these things with caution. You don't want to stress yourself out trying to get the baby out by doing all of the things that you can and overthinking it, because these cause a stress response that is actually what is causing your labor to be quote unquote delayed or, not spontaneously happening, even if your body is ready. So just a tip that if you are trying to naturally induce labor, be sure to check in with yourself and give yourself enough time to rest and relax too. But if you are interested, some ideas, if you're not sure where to start, are, prenatal chiropractic care is a top recommendation of mine, specifically finding someone that is Webster certified. They are specifically trained in pregnancy. That's what that certification is for. Acupuncture has also some great benefits. Gentle movement like walking, specifically curb walking or sideways walking on the steps for that asymmetry in your pelvis to encourage your baby to engage. And then that would hopefully encourage labor to start as well. Gentle prenatal yoga is good for movement. Herbal remedies like drinking red raspberry leaf tea, eating dates, intimacy with your partner increases oxytocin or that natural contraction hormone that can help progress labor. You can also look into spinning babies exercises for natural induction techniques and also nipple stimulation if you are looking for even more things to try. These techniques can help your body prepare for labor without unnecessary invasive interventions. Just make sure to discuss any of these options with your care provider to ensure that they are safe for your individual circumstances in pregnancy. And then finally, education and mindset are absolutely key in this process of waiting for labor to naturally begin on its own and hopefully avoid an induction if that's part of your plan. When you understand the risks and the benefits of induction, you can approach your decision with confidence, 100%. It is often the case that families are not educated on induction whatsoever because they will schedule an induction and they will show up to the hospital to be admitted, and they won't have any idea, like I had mentioned before, about why they are in the hospital for an induction, why they agreed to one, what the process entails, how long they'll be there for, any risks or benefits in terms of the induction or the medications used, things like that. The benefit is, you just want to meet your baby, right? And of course, everybody is waiting for the time that they get to meet their baby for the first time. So when a provider is kind of giving you that little bit of a nudge saying, we have an opening in our schedule, would you like to meet your baby today or, tomorrow morning? It's often very tempting. So I can just speak to the number of times as a labor and delivery nurse that I helped admit and settle a patient into their room on labor and delivery that was there for their induction. And I had to do so much education, which I love the education piece, but it would have been nice to, have met this family hours before, weeks before, or even just days, obviously, if it was a medical induction, something like that. But it would be nice to have the space and the time to answer all the questions of the family, give them all the information, all the options, and give them time to think about potentially what options are going to be available to them and which they would like to proceed with, whether that's, in regards to cervical ripening, would they like something more pharmaceutical with, the Cervidil Cytotec realm, or could they jump right to Pitocin if their cervix was ready for that, or would they like to try a Foley balloon, something more, it's manual dilation, so that doesn't involve any medications that are given to you. So there's different things in induction that are not just standard for all women, that there's choices that you do have along the way. There's choices on how, your room is set up and how you can cope in those early stages of ripening, and priorities in terms of resting and making sure that you're hydrated and that you're eating. All of these things are important to know about ahead of time, that if you're just, brought into the hospital and told XYZ is the next steps, it's very hard to advocate for yourself in those situations because you just don't have the information. So it's not because you can't, it's just because you don't maybe know how. And this is a really important piece when talking about inductions and about, making sure that it is the choice that's right for you and not getting to the labor and delivery unit and these things are starting to happen to you. Maybe your cervical ripening, that first initial part of the induction is started. And then you're thinking, wait a minute, what am I doing? I thought I was going to have a baby in 12 hours. But it's just those expectations are not always accurate. So I just wanted to mention that if you are thinking about an induction, it's definitely an important piece to look more into it. If you have a doula, that's a great resource for you. If you're looking for additional support, I definitely am available to chat to about all of your options. I love consultations with clients and figuring out what their situation is and how to make their birth preferences happen. So there's lots of options out there if you are considering an induction. There's also lots of options out there if you don't want to have to consider an induction for medical reasons or electively, and you would like to talk to somebody about those options and about how likely that would be for you to avoid an induction. So there's so much that we can go over. I could talk forever about this because it is so common for people to be encouraged to be induced at a certain point, usually around 39 weeks, if not for sure by 40 weeks. Usually an induction is scheduled, but I'm happy to support families in making that decision for themselves and understanding what is best for them. And I kind of just went off on a tangent there about that piece of it, but I did want to just mention that I did recently meet with somebody that for sure did not want an induction, and every time she would go into her provider's office, she would be very much fear-mongered and encouraged, and even before the appointment she would be told to bring her hospital bags to the hospital because she was going to stay for an induction, and that was just something that the doctors were going to choose for her based on a few things going on in her pregnancy. But it isn't as simple as just somebody telling you what to do, even if they have a reason to believe that. There is information that needs to be given to you, whether it is for gestational diabetes, or if it's for advanced maternal age, or you're having a big baby, or, there's just certain things that maybe have come up in your pregnancy that is a red flag to your provider. They can definitely voice that to you, and you can also ask questions about what that means for you, what that means for your induction, for your pregnancy, for your labor, and what your options are if you waited another day, or if you waited another week, or what would happen if is always the great discussion to have, and fully dive deeper into not just agreeing at the first sign of an induction and asking for more questions. Because that one client that I had met with several times, she went to 41 weeks and 6 days, and she had a beautiful, unmedicated, spontaneous vaginal delivery. And it had been weeks that her provider was encouraging her to have an induction, ever since she was 38 weeks. So that was, almost 4 weeks later that she had no complications, a beautiful birth, and she felt fully in control and had this autonomous, beautiful hospital birth experience. So I was so happy for her, and I was so glad to be able to support her through those challenging appointments that she did have, and really feel good about her decisions, because she was willing to take the responsibility of anything, potentially going wrong based on her provider's recommendations, but she felt intuitively that it was going to all work out as it did, and it did. So there is just more to the conversation than just agreeing to an induction or automatically being induced at a certain time. Everything should be customized to you. You should be listened to. What are your values? What has your pregnancy been like up to this point? How are you feeling? And there is just so much more to this conversation that I would love to help anybody out there if they are interested in additional support. And then as far as mindset, tools like affirmations, journaling, mindfulness practices like meditation can also really help you stay grounded and not spiral into that worrying and fear that often does lead moms to agreeing to an unwanted induction. Instead of focusing on the calendar and your due date, focus on your body's strength and its capability to birth your baby, and that you are made to do this, and that your body and your baby are going to work together, and eventually labor is going to happen, right? You are going to go into labor spontaneously eventually. So let's summarize what we've talked about in 5 steps that you can take today to prepare for a confident, induction-free birth. So ask questions. If an induction is suggested, ask for evidence and weigh the risks and benefits that are specific to you, not just to general standard hospital guidelines and policies, truly to your own situation. Find a supportive provider. Choose a midwife or care team that aligns with your values and that you know will support you those last days and weeks in the way that you are envisioning. As a home birth midwife, having longer appointments to connect with and educate families about their care and options is so important, and also provides space to dive into any worries or fears around their birth that could also be contributing to their body not yet going into labor. The mind is so powerful, and that is a huge piece of supportive midwifery care too. Also, practice patience. Use mindset techniques like affirmations to stay calm and grounded. Ask for help if you feel like you are spiraling or you're worried about going past your due date. You truly won't be pregnant forever, but I know it definitely does feel like that some days, especially when you're getting to the end of it. So finding supportive people and the ability to stay patient as long as you and your baby are safe and you are feeling good about this decision. Use natural techniques, trying methods that I mentioned to help your body prepare for labor, but also remembering not to overdo anything and stress yourself out, because that can just counteract what you are trying to do, which is get your body into labor. Educate yourself, learn about the natural variations of labor timing and how induction may impact your birth. The more you feel good about how things are going and that it is normal and common and you have these realistic expectations, the less worry and fear there will be that tempts you then to schedule an unwanted induction. Thank you so much for joining me today on Your Birth Bestie podcast. If you're interested in learning more about natural pain coping methods for labor, I have a free guide you can download that is linked in the show notes below. It breaks down suggestions for each stage of labor that I think you will find really helpful. Also, don't forget to subscribe to the podcast and leave a review if you found this information helpful. Thank you so much for tuning in, and I will see you again next Tuesday. Bye, everyone.